Rheumatoid arthritis is estimated to affect approximately 0.24 to 1% of the Indian population and to be twice as common in women compared with men. It affects more than 180 million people in India. The prevalence is higher than many well-known diseases such as diabetes, AIDS, and cancer. Around 14% of the Indian population seeks a doctor's help every year for this joint disease. At Medicircle, we are conducting an exclusive series on the occasion of the Rheumatoid Arthritis Awareness Day. Hi, this is Sana Khan, and today in this initiative, we're going to speak to Dr. Bhowmik Meghnathi. Dr. Bhowmik Meghnathi is a consultant rheumatologist and clinical immunologist. He is also an EULAR, that is European League Against Rheumatism certified adult and pediatric rheumatologist. He has 12 years of experience in this field. He is currently working at SIMS Hospital at Ahmedabad in Gujarat. He has special interest in spondyloarthritis and psoriatic arthritis. He has been trained in rheumatology at New Delhi and later obtained the prestigious ASAS fellowship at Paris. He is also the only Indian rheumatologist at the Assessment of Spondyloarthritis International Society and is also a member of the International GRAPPA Society, that is the Group for Research and Assessment of Psoriasis and Psoriatic Arthritis. Hello, Dr. Bhowmik. Welcome to Medicircle.
Hello, greetings for the day. Thank you very much for inviting me on this platform.
It's our pleasure, sir. Okay, Dr. Bhowmik, what are the signs and symptoms of rheumatoid arthritis and when to visit a doctor in case one identifies any symptoms?
Right. So first and foremost, let us start by understanding what arthritis is. Arthritis basically means that joint is tender, that it is painful, and it is swollen. The terminology arthralgia means there is only pain of the joint, whereas arthritis means that there is inflammation of the joint. So the joint is not only painful, but you may notice that there is swelling over the joint. You may notice that the joint is at times warm when you feel and touch over the joint. There is restriction of the range of movement at times over the joint, and there is loss of function or the activities of daily living could be hindered. Rheumatoid arthritis is a prototypic polyarticular disease, meaning that more than or equal to 5 joints are involved, and it is a classical symmetrical polyarticular disease. So at one point of time, you see that many joints are involved. Most of the joints of hands are involved predominantly. However, at times it can be a atypical presentation as well, and there can be only knees or ankle joint involved as well. So overall, usually you see arthritis, so that is joint pain and swelling. Along with that, if it is a systemic disease which has persisted for a longer duration of time, you might see some constitutional features like fever, loss of appetite, and feeling of extreme fatigue or tiredness. So these are overall the major signs and symptoms of rheumatoid arthritis.
Okay. Doctor, do dietary changes help in easing out the effects of rheumatoid arthritis?
This is one question we always invariably face, and our patients always ask us that does our diet have any role in the management of the disease, or does my diet cause rheumatoid arthritis?
Right.
So the answer is not straightforward. What we can say is that there are certain lifestyle risk factors that may put you at risk for developing rheumatoid arthritis. Especially when we talk about males who smoke, smoking tobacco is certainly a risk factor which can lead to precipitation or activation of rheumatoid arthritis, whether it is an active form of smoking or passive form of smoking. Even if you are surrounded in an atmosphere where other people are smoking, but you inhale that smoke, then that also predisposes you to a certain risk factor. So the females in their house whose husbands have a habit of smoking, they are invariably exposed to the passive form of smoking.
Right.
So that is one lifestyle way. Talking about diet, then again, we need to categorize diet which have a tendency to increase your inflammation, and there are certain diets which have a tendency to decrease your inflammation. So pro-inflammatory and anti-inflammatory diet. So when we talk about pro-inflammatory diet, diet which is high in refined sugars, carbs, pastries, fried food, French fries, burgers, junk food, all those diet which are considered as pro-inflammatory diet can increase the disease activity. However, if you consume a lot of fruits, fresh vegetables, which are rich in vitamin C, like amla, berries, blueberries, strawberries, or you eat a lot of fresh green leafy vegetables. So basically, fresh fruits and vegetables which are high in antioxidants. That is a
Right.
rich source of anti-inflammatory diet.
Mm-hmm.
Talk about a non-vegetarian diet, that should be rich in omega-3 fatty acids like fish, like a salmon or tuna. Those can be very rich sources of providing you omega-3 fatty acids, and that can be helpful in controlling the rheumatoid arthritis because it has an anti-inflammatory property. There
Okay.
are certain foods which have been used, like turmeric. People have often used in milk and have used it that does occasionally have beneficial effects.
Mm-hmm.
Like avocado can help you with the osteoarthritic part. It can help you lubricate the joints. So there are certain fruits as well which you may find it beneficial.
Okay.
And the most important question that they ask is कि क्या हम खट्टा खा सकते हैं? Can we
Right.
eat sour food?
Very common
Eat the
question.
that is the most common thing which we encounter. So the
Right.
answer to that is that there is no clear answer for each and every person. So if there are 100 patients with rheumatoid arthritis, if say 80 to 85 of them eat pickles or eat sour foods and are able to tolerate it, then we will encourage them to eat whatever their body is taking and is suitable for them.
Right.
However, if certain patients with rheumatoid who have noticed that time and again when they take any sour food or any pickles or anything which is fermented, and they notice that their joint pains are actually flaring after every meal that they consume with
Mm-hmm.
such sour foods. In such
Right.
scenarios, we suggest that your body might actually be allergic to that kind of food substance, in
Right.
which case, in your particular case, you may try to avoid it.
Mm-hmm. Okay, there is a myth stating there isn't any treatment for rheumatoid arthritis. So people just have to live with it. So is it true, or can rheumatoid arthritis can be cured?
Okay, so the myth that there is no treatment is absolutely false. There
Okay.
are wonderful treatments available for treating rheumatoid arthritis.
Mm-hmm.
So broadly, as rheumatologists, we classify the treatment under 3 to 4 major groups. So which are called as conventional synthetic disease modifying drugs,
Mm-hmm.
targeted synthetic disease modifying drugs. Then
Okay.
there are biological drugs, which are again categorized as bio-original drugs or biosimilar drugs.
Right.
So basically, what we're talking about is with the conventional synthetic disease modifying drugs, there are drugs like methotrexate, leflunomide, hydroxychloroquine, sulfasalazine. Now we have egoretimod type of drugs available. In the past, people used to use gold, which was available as an injection form
Right.
15, 20 years back, but because of the side effects, it has been withdrawn. There are other drugs like small molecules which are called as JAK-STAT inhibitors, tofacitinib, baricitinib, which are small tablet kind of medicines which can be
Mm-hmm.
used, and they give excellent results in treating rheumatoid arthritis. Then
Okay.
there are other drugs which are called biologicals, which are injections. So these injections are the next level of medication which can help you control all those rheumatoid arthritis which are not controlled by the conventional synthetic disease modifying drugs. So there are different categories of drugs which are
Mm-hmm.
the biologics cost a bit more, but hence we have now biosimilar drugs which have brought down the cost of such medications quite at a very cheaper rate as compared to what is available in Western world.
Mm-hmm.
So the myth that there is no treatment is absolutely false. The earlier you get yourself treated and the earlier you achieve a remission or low disease activity in rheumatoid arthritis is the target. The earlier you do it, the better the chances that your disease would be under control.
Right.
Now, the question, part of the question, is there a cure? So, if I were to ask the same question, replacing rheumatoid arthritis with hypertension or diabetes, and if I had to say that is there any cure for hypertension? Is there any cure for diabetes? The answer is no. But the
Mm-hmm.
answer also is that you can very well control it and live a
Okay.
normal life with
Right.
medication. So
Mm-hmm.
if you have seropositive rheumatoid, which is there for long years, then it is controllable. I would not say
Mm-hmm.
cure. But if your disease is very early in the disease state, so it's a very early rheumatoid, mild disease activity, then you may lead a life where you might need very less medicine, or even after medicine is stopped, you may live a life which is called as without medicine, which is called as drug-free remission. But it
Okay.
is not equivalent to cure, because if in case
Mm-hmm.
your disease rheumatoid flares, you might have to start the medicines again. But
Right.
control is certainly possible. Like blood pressure, like hypertension, like diabetes, you can live a normal life with medication, And the word elusive cure is restricted when there is acute arthritis. When it is chronic arthritis, we invariably talk about control. So that's the short answer to it.
Rheumatoid arthritis is a disease that is not uncommon and is estimated to have a prevalence of about 1% of the population in India. Do you think early detection can lower the counts?
Another nice question. So I would say we cannot change the prevalence. So I would say if the patients know the symptoms and signs, on the contrary, we might be able to pick up those rheumatoid arthritis which used to present late to us. And if they present early, the counts or the prevalence of the disease might remain the same or might marginally increase as well. But as I said, what is important is that you identify whether you are suffering from it or not, take regular medicines on time, and if you are lucky enough, you might be able to go into drug-free remission or at least achieve a low disease activity or remission with the medication and live a normal life.
Right.
So what I would say is it certainly lower the misery. We are not sure about the lowering the counts because lowering count is dependent on multiple factors. It depends on the genes. It depends on the environmental factors. There might be many factors which might be triggering rheumatoid arthritis. So in general, the prevalence might remain the same, but the misery can certainly be reduced. So that should be the answer to that.
Thank you so much, Dr. Bhowmik, for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Pleasure is mine. Thank you very much.
Thank you so much. Have a good day.
Thank you.